Okay, let's see if it's working. Yeah, it's working. Okay, so you can see there.
Yeah,
Yeah, well,
yeah,
open your 3 minutes.
yeah. Thank you. Hello.
Hello.
My name is Dr. Sana, one of the GP from the practice. Can I speak to Jessica White?
Oh yeah, doctor. I'm Jessica White.
Yeah. Uh, so before proceeding, can I confirm your age as this phone call is recorded?
Yeah, it's 35, doctor.
Okay. So I understand that this appointment is to book to review the bloods that you had 1 week ago with my colleague.
Oh
Is this
yeah, sure.
something you want to discuss, or you want to discuss something else?
No, just the blood test and someone to give me the answer why I feel so knackered, doctor.
Um, just want to check with you, did my colleague mention what could be the possible reason, or did you had any thoughts in your mind?
No, not really, doctor. He said we'll check if you're having low bloods and your thyroid function and that's it.
Mm.
Yeah,
Okay.
but but he didn't
Um,
say anything else.
Some people want to prefer to know the blood result first and then allow the doctor to ask the question because I need to ask question to know what could be the other possible reason. Which way do you prefer?
Well, as you like, doctor, whatever you feel comfortable with.
Okay. Yeah, so I can ask some questions related with your blood test and then I can go through with you. So I can see from the notes that you were feeling tired and you told me that you're feeling naked. Can you tell me more about it?
Oh yeah, doctor. Whenever I'm sleeping, doctor, I wake up like I didn't sleep.
Hmm.
Yeah,
Yeah, I'm sorry for
that,
you feeling, yeah, feeling like that. Anything else apart from feeling tiredness?
no, not really, doctor. It's just I feel physically tired.
Hmm. So sometimes people with tiredness do feel like they are feeling breathless.
Hmm.
Are you having something like that?
Well, doctor, I don't have the capacity to do much physical work to feel breathlessness, to be honest.
Hmm. And with the blood test result I have in with me, um, it is showing your thyroid, one of the gland in the neck, is working less than normal it should be. We say underactive thyroid or hypothyroidism. Is this something you were expecting?
To be honest, not really, but is that something serious, doctor?
That's a good question. But whether it's serious or not, or what could be the other possible reason, is it all right if I can ask questions and then um, get back to this answer? I'm writing down in my notes.
Yeah, sure.
Yeah. So, by any chance, do you feel that any tummy pain at all?
No,
Yeah. And any problem with your bowels?
I think I'm more constipated than usual, doctor.
Okay. And what about your periods?
Well, it's all over the place.
When you
Yeah,
say all over the place.
yeah, sometimes it come twice a month, and then most of the day, the month that I will skip the period, But that's
Mm-hmm,
not something bothering me. I mean,
mm-hmm, mm-hmm. And what about in the family? Anyone got any problem with the thyroid?
no, I'm not sure. I was fostered, so I'm not sure my biological parents. I don't know them.
And you're not using any medication, I can see from the record.
No, no, I don't use any medication at all, doctor.
And how do you perceive your weight?
Well, I'm no doctor. I'm way than normal. I know that I'm big, but that was one of the things that I was hoping that someone can help me with.
Mm-hmm. Definitely, I'm here to help you with that. But have you tried something in past, and what were you hoping? How can you help you?
Well, I'm not quite sure, doctor, but I heard this about the new injections that, probably they are saying that it can help a lot.
Mm-hmm.
So
Mm-hmm.
maybe if you can prescribe it for me, that will be helpful.
Mm-hmm. I will write down. I'm writing down, and then I will discuss with you about and answer you whether you can have injections or not.
Mhm.
Um, Yeah, and quick, some few questions related with your social lifestyle because sometimes social lifestyle can affect with the weight gain and also causing a problem with the tiredness as well. Do you smoke?
Oh no, doctor, I don't smoke.
That's good. And do you drink alcohol?
No, at all.
And what job do you do for your living?
Well, I'm accountant.
And how much this tiredness is affecting you?
Mm, well, it's just the physical activity. I'm thinking my brain is bright. I mean, I don't feel any problem with the brain, if that the
Mm-hmm,
question is.
mm-hmm, mm-hmm. And who do you live with?
I have my partner.
Okay, and how's your mood?
Well, it's not great, doctor, because because I feel tired, so I don't feel myself at all.
Mm-hmm, mm-hmm. And when you say you don't feel yourself, do you feel like any problem with the sleep or you're not enjoying day-to-day activities?
No, I'm sleeping more than usual, I guess.
Mm-hmm,
But no, no, I didn't lost any interest. But when I feel that I don't have the physical capacity, that's
mm-hmm,
make me annoyed little bit because also I'm trying to lose weight, but I don't have the power to do the things, so I'm not sure.
Mhm, mhm. Definitely, we are here to help you. Thank you for answering the questions. As I mentioned early, we have blood test results with us, and you don't have any low blood. That's a good thing. But the thyroid hormone is one of the hormones that control our wear and tear and the metabolism in our body. It's functioning less than normal. It should be. We say underactive thyroid or we say hypothyroidism. As you mentioned, no one in the family had this condition, but have you heard about this condition?
Mm, no, not really, doctor.
Okay, so do you want me to tell you?
Yeah, well, I'm happy to hear.
Yeah. So when the one of the gland, which is a butterfly-shaped gland in the neck, when it's working less than normal, our whole body metabolism becomes slow, and people do gain weight, struggle with the mood, and also like struggling with the bowel, like constipation and the periods, like in your case. And the good thing is that we have picked up the reason for you why you are gaining weight, as this when your thyroid is working less than normal, it can cause weight gain. What
Oh,
we can
okay.
do, yeah, yeah. So is this something you were hoping today to hear about?
To how to treat me. Well, if you will treat me, then that will let me lose weight. That's,
Mhm.
yeah, I'm very happy for that for sure.
So yeah, so normally we do prescribe tablet, we say levothyroxine, artificial form of thyroid hormone in the form of tablet that you need to take early in the morning and can have breakfast 2 hour after. I will start on a low dose. Do remind me, I can see there is you don't have any heart problem in the past.
No, I don't have any heart
No,
problem.
okay. So I can do the prescription from 50 microgram once in a day, and we will arrange a repeat blood test to check in 6 week time how your bloods are, whether we need to increase the dose of levothyroxine. I would suggest avoid breakfast at least 2 hour. Yeah, and
Mhm.
uh, and
Shall I take it
you
with my
mentioned
coffee,
about,
doctor?
sorry.
Can I take it with my coffee?
As I said, like the coffee is something that will reduce the absorption of this tablet. So we advise to avoid the caffeine with the tablet, but you can take a couple of hours after taking the tablet so that it will not affect the absorption of this tablet. And
Okay.
you mentioned earlier regarding injection for
Mhm.
weight loss. I know it's been going on a lot, and injections are good to help with the lose weight. But in your case, we know that what is the reason for the weight gain. The thyroid hormone is working less than normal, so injection is not a first choice. Is something that we offer. We go what I can suggest, like we can start levothyroxine. I can get in touch with the dietitian to review the diet, and it's something we can plan whether how you can do small steps like to have the more physical activity. Is this something have you thought about it? Or
Yeah,
have you
yeah.
tried some? Yeah. So like using stairs when you're going to the office, if the building is on the top floor, try to park the car away from your workplace. Try to have 10-minute walk. Yeah.
Hmm.
And do try having a little bit of walk, 10-15 minute, as much as you can tolerate. Go with the pace, not to be harsh on yourself. And one more thing, apart from thyroid for hormone test, I will request another blood test. We say thyroid TPO antibody to check for sometime our body is active, working against our own gland like thyroid hormone. So I want to rule out is there any other problem which is causing this thyroid to work less than normal. And I want to check the Q risk score as well. It's something,
What is that?
it's a scoring that we check, as you don't have any other problem in here, but I need to check if Q risk is more than 10. It's something we can give you and discuss further medication like lipid lowering medication from like it's something we check the scoring how much chances you have if any problem with the heart can cause this problem. What I would suggest in meantime, if you feel you're feeling really tired, you're feeling your heart is beating faster than normal, you're feeling really unwell, you can call 111 and call us back. Again, I said I will arrange a follow-up appointment to do the blood test, and I will send you the leaflet information.
Mm-hmm.
And it's wise if I can book face-to-face appointment to feel your thyroid, to check blood pressure and the pulse. What do you think about it?
Yeah, blood pressure and pulse. Yeah, that's fine, doctor. Yeah. Do you want to check my blood pressure and pulse? Yeah. Anything
Yes,
else you want to check?
blood pressure, pulse, and feel the thyroid.
Okay. Okay. Why you would like to feel the thyroid, doctor?
To check for any abnormal swelling in the neck, like thyroid lymph nodes, and to check for the thyroid, is it how it feel like? Is it soft or is it firm or is it irregular in shape?
Okay, sure, sure. Yeah, and should I take the thyroxine for life or what, doctor?
Uh, it's something, the levothyroxine, if we start, then you need to take lifelong, because your thyroid is working less, and it's something we can manage this condition in the long run, and we can control the symptom and control the thyroid, as your thyroid is not producing thyroxine hormone. So you need to take the thyroid hormone in the form of artificial tablets to continue to have a balanced metabolism in the body, and for your body to function normally, and also help you to lose weight as well.
Sure, sure, doctor. Okay. Yeah, thank you very much, doctor. Anything else,
Thank
doctor,
you.
you would like to talk? Anything else you would like to ask about, doctor?
Mm, um, I don't know. I should have asked about swallowing problem, speech problem,
Yeah,
hoarseness
exactly.
of voice, to check for the
Yeah.
cancer.
Yeah, yeah, cancer, well, it's less likely, is it? Less likely because she's she's already saying that I'm overweight, is it? Less
Mm-hmm.
likely to be cancer and overweight, isn't it? Yeah.
Mm-hmm.
But when uh, the trick in this case is it's multiple things, isn't it? So it's tired all the time, there is morbid obesity,
Mm-hmm.
and she is hypothyroid. So these are the main three boxes that you need to tackle, is it?
Mm-hmm.
So she's worried about being tired all the time. So we didn't ask about other question about tired all the time, especially that she is having morbid obesity. So does she have diabetes?
Diabetes. Yeah.
Does she have obstructive sleep apnea, which is very related to obesity hypoventilation syndromes? And
Mm-hmm.
it's part of the parcel, isn't it?
Mm-hmm.
So at least one of these two things, to be asked, and then the mood, and depression and anxiety,
Mm-hmm.
stresses in life. Just, at least three more causes of feeling tired all the time, just to show the one who's hearing you that you are you thought thoroughly about this, about tired all the time. So this is the
Mm-hmm.
first box that you want to assess. Then the other box that you want to assess, okay, the morbid obesity and how it's affecting her life and self-esteem, and what she thinks, how she wants us to help her. Okay, so
Mm-hmm.
does she, when she said that she need the injection, are you able to provide her the injection with the current guidance? Or can you come over that by asking about, probably if we find you diabetic or having high blood sugar, we might
Mm-hmm.
consider that in the pipeline in the future, keeping in
Mm-hmm.
mind, taking this injections is just helping you to lose weight, but once you stop it, your weight will gain again. So the goal here is to tackle your metabolic issues or your
Mm-hmm.
thyroid function issues, plus
Mm-hmm.
lifestyle modification, or referring you to the weight management services. So this is the second box you need to tackle, and then the third box is the thyroid itself. So when I think about thyroid, I think about three things. Is this a metabolic emergency and we need to act now? Is there is anatomical emergency and we need to act now as well? Okay, or it's simple hypothyroidism and all what I need is just replacement. Okay,
Mhm.
so if there is a metabolic emergency, so does she feel cold? She's severely hypothyroid? Is there is any
Mhm.
leg swelling? So for myxedema, myxedema pre-coma symptoms, for example, does she feel muddled? Okay, how her
Mhm.
sugar level? So these are important to ask, okay, because you need to see how severe is her myxedema or how severe her hypothyroidism is, yeah. So does we need now to act fast to rapidly reverse her hypothyroidism, or that can be corrected slowly? And then,
Mhm.
so does this hypothyroidism associated with goiter or not? That's important because if the hypothyroidism is associated with goiter, she need to go to ANT. Yeah, she need to do surgery. So that only thyroid replacement or that need also surgical intervention? So you need to ask about does she have difficulty in swallowing? Does she have difficulty in breathing? Because when she lie flat, okay, because of the compression of the thyroid, or does she have hoarseness of voice? So those are the three compression symptoms or compression manifestation. Does she have congested neck vein, for example, as well? Okay, that's important to know. And then the third thing, if these are no, is the replacement. So this patient is really problematic in real life. Her weight is 190 kilograms. Okay, how should I replace her thyroid? Does 50 microgram will do something for her? So how I will replace the thyroid is I'm replacing the thyroid for a patient. His weight is 60 kilograms. Is the same as the when I'm replacing the patient 100 kilograms. Is the same as a patient his weight is 160. Provide that there is cardiovascular risk or not, which I like that you ask about. But also these things need to be considered. For sure,
Mhm.
weight here will have a factor. Okay, how to replace the patient, um, thyroid, isn't it?
Mhm.
What do you think?
I think it should be higher. I was thinking whether should I say 100, but I said I will start with 50 and then I will increase. But I think
Well,
it should be 100
well,
in her case, 190 kilo.
I'm usually starting low and go slow. Yeah, but how low I should start? This is the issue. Okay, but this patient is 190, yeah, and you know that the usual dose is 1.6, isn't it? 1.6, yeah, microgram per kilogram. So for
Mhm.
this patient, 1.6 microgram per kilogram, that's really 300 microgram.
Mhm.
So shall I start 300 microgram or shall I
Mhm.
start less? So usually,
Arrhythmia.
yeah, so this is the issue. And does patient have morbid obesity? Does they need that high amount of thyroid? Because if I use the actual body weight, that will be misleading. Because again, fat tissue, if they are have their that weight because of fat tissue, maybe she's muscularized or maybe she's a bodybuilder. How we will know? Okay, that's also one of the things that we need to consider. Okay, is the fat distribution, is that all this body weight is fat or muscles or what exactly that's need? Because if that muscle, I will start 300 microgram without blinking. But if that is fat, I will be eager to start less because the fat tissue doesn't need that amount of thyroid thyroids or thyroxine to make it metabolically active. Fat, you know that fat is not that metabolically active. Okay, yeah, fat is an endocrine tissue. Okay, because it produce hormones, but it doesn't need that blood supply and that energy to start to produce these hormones. Okay, so I would be eager to start less. So that patient, if she starts in 30, I will not start her more than 100 microgram, but 50 microgram will be very low. So I will start
Mhm.
100 microgram and then review her. So when I will review her, that was important. I didn't hear that. Yes,
Six to
six
six to
weeks.
8 weeks.
Yeah,
6 weeks.
yeah, 6 weeks. Yeah, at least 6 weeks. So I need to hear that. So you will do it now. We'll follow it up after 6 weeks, and then we'll see how the things will go. That was important also to you know to pronunciate that. Yeah. Um, in general, it's a difficult case. Okay, I will just give the general feedback, and then after that, we'll close the recording, and then I will give you your specific feedback and where you can improve. Okay.
Mm-hmm.
So in general, if you have a look, these are the main causes of being tired all the time. Okay, so either anemia, which was excluded by having the full blood count because her hemoglobin was normal. Okay, so patient doesn't have anemia. Okay, the other thing is endocrine things, and then hypothyroidism was there. Okay, we need to exclude the diabetes. Okay, Addison and hypothyroidism is not uncommon to be combined, okay, but it's difficult, I think, at the GP level to bring a combined hypothyroidism and Addison together, okay. And then chronic infection, it's not unwise to ask about chronic infection if you had, time, but in that case, I will not miss to ask about obstructive sleep apnea, okay, because obesity hypoventilation syndrome are very common. Okay, I would always ask about if she's snoring, she feels suffocated at night and wake up from her sleep because of feeling suffocated or not. Okay, um, and address that for sure. And then the sleep hygiene, chronic infection like long COVID is one of the things also we need to consider it. If she's taking any opioid or alcohol abuse, however you ask about alcohol and smoking, so you did cover that. And for sure in case so basically we'll consider tired all the time causes three main categories. So physical or organic, okay, and psychological or psychosocial. Okay, psychological if you have depression or any mental illness, okay, or burnout even, okay. And the social part of it if she's overworking, okay, overworking, that's also important. Okay, over exercising or lack of exercise, which is as this case as well. Okay, miscellaneous, which we need to keep it always in our back of our mind, is does she have chronic fatigue syndrome? Okay, not fibromyalgia. Okay, because fibromyalgia will mostly come complaining of what? Mostly the fibromyalgia.
Pain.
Pain, yeah. So the main symptoms of fibromyalgia, the unproportionate pain, okay, which you can't find, any physical illness or physical evidence of it, rather than being fatigued. For sure, the pain will lead to fatigue, but the main issue for the patient is the pain, the unproportionate pain for the physical signs. Okay, but chronic fatigue syndrome, which is very common after viral illnesses or even chronic health issues. Okay, that's one of the things that we need to consider. Okay, that patient I would add on the things that was not added. So I would ask for blood pressure, I would ask for cholesterol and lipid profile, and then for sure hemoglobin A1C, and what else I can provide for her because she have
Ferritin?
high risk cardiometabolic. Yeah, well, ferritin, I don't. Well, ferritin, I will be less likely to be, running to order it because her hemoglobin is,
TPO
is, is
level,
normal. Yeah, her hemoglobin. Sorry.
thyroid peroxidase antibody like Hashimoto
Yeah, yeah.
thyroiditis.
That's okay. I'm not against it. I'm not against it. Hashimoto thyroiditis, although usually the thyroiditis will come first with bouts of
Hyper.
hyperthyroidism followed by hypothyroid. Okay, so she will
Mm-hmm.
tell you I was snappy, losing weight, and then suddenly I gain all the weight. Doesn't seems to be typical Hashimoto thyroiditis type, or even
Mm-hmm.
viral thyroiditis type of
Mm-hmm.
infection. But I won't say wrong. I will not say that's wrong. If you would like to do it, yeah, why not do it? Okay, I can't feel that it's medically unexplained. Yeah, you can. I'm not against that at all. Okay, but at least to add on, because this is a missing story, isn't it? The
Mm-hmm.
problem with this case that it's they bring you the story from the middle, and that's the difficulty in such situation, because you
Mm-hmm.
are you need to build up on um, the management plan done by someone else. Okay, so you need to think about his management plan, approve it or disapprove it, and build on it. and that's the problem because you need to find where is the missing puzzles. Okay, so there was a lot of missing puzzles there that you need to, build it up there. Plus addressing the patient concern, which her, that she need to lose weight and she's tired and she need to treatment of her thyroid, isn't it? So there
mhm,
was a lot to address, but at least I would to add some blood tests to exclude, your sugar level and okay, you don't need to say all of them, but at least to say something that's, you know sh-
mhm,
will show that you are thinking in something else that might cause her first symptoms of being tired, second
mhm,
complication of hypothyroidism, and the obesity as well. Yeah. So, and this what how we can. So usually, which will come to it, the types of weight um, in medicine. Okay, so we have the actual weight, the ideal body weight, and the adjusted body weight, and the lean body weight. And each weight of these, we are using them in specific categories. In patient with problem with weights, okay, usually we use the not the actual body weight, we usually use the adjusted body weight, so the adjusted for the fat, so and that, there is a lot of formulas. You don't need to save these formulas because uh, easily you can open mid-calc and then just put the patient weight
mhm,
and height, and they will calculate for you his adjusted body weight, and according to the adjusted body weight you can calculate the thyroxine. Okay, but in general, if the patient have weight issues, okay, and he's massively need a lot of thyroid electroxin, I will start 100 microgram maximum, and I will build up according to the response to the patient, and I will
mhm,
explain to him that actually because yeah, usually the initial dose is 1.6 and that will lead us to 300 mic, but I feel that little bit too much for you. I would like to reach maybe to start with 100 mic and then see how you will respond to it, and it's just to avoid any complication or from the medication. What's your thoughts, and see what the
mhm,
patient will say, because there is no rush, there is nothing here pushing me to rapidly reverse his thyroid function. Okay. um, there is no emergencies. Okay, there is no goiter symptoms, there is no metabolic emergencies, then I won't be pushing to too much with the thyroid. Okay,
mhm,
so you can see here the 1.6 microgram per kilogram. That's for the normal individuals. If you take it for that patient, be like 300. Okay, then that can lead to overestimation or over treatment, and can lead also to rapidly normalize the TSH, and that's not something we are, looking for. Okay, and then also the morbid obesity can lead to overestimation of the amount of the thyroxine needed because adipose tissue is already having lower metabolic demanding tissues. Okay, so either you will, as we said, will start with the 100, okay, which is a um, reasonable amount, okay, or you can use the adjusted weight, okay, and these are the formula, and then with the formula, then you can adjust it will be around 150 microgram or something. Okay, so
mhm,
again, also 150 is considered to be reasonable, but I will go for the lower one, for the reason that I mentioned from before. And always
mhm,
don't forget to review within 6 to 8 weeks. And also to make sure, as you said, don't take the thyroxine, take it in empty stomach. Okay, avoid, the breakfast after it by at least 1 hour. Okay, and don't take any caffeinated drink with it because that's one of the most common problem. Okay, that you will face, that the patient is always drinking the electroxin with his caffeine. Okay, and that will lead to, unfortunately, decrease the absorption and the efficacy, and we'll keep thinking, okay, why his thyroid function is not improving, and actually because he's sticking with the coffee. Okay, as well as caffeine, calcium, and iron. Okay, so the types of weight, what are the types of medical weight? So the actual body weight, okay, which the weight that will appear when the patient stand on the scale, okay, and that usually we are using it for for weight management. Okay, if the patient were trying to lose weight or you're tracking his general health, this where we use the actual body weight. And then the ideal body weight, which is the healthy body weight, which when we do target, okay, patient is obese or patient have is overweight or his his outside of the normal scale that we would like to, so we'll take his height and then we'll say, okay, so most probably we need the target of your weight will be that. Okay, would you like to reach that or you want to decrease the target a little bit? Okay, and then for the people who have morbid obesity or overweight and you want to calculate dose of the drug for them, so you will not use the actual body weight, you will use usually the adjusted body weight. Okay, to avoid the overestimation of the amount of the drug. Okay, then the lean body weight. Okay, the lean body weight, we are using it in certain medication like antibiotic that are concentrated, lipophilic antibiotic that are concentrating in the adipose tissue. So antibiotics and some of the anticonvulsant drug and also the diazepams. Okay, we use the lean body weight because if we use the adjusted or the actual body weight, again, both of them are taking the lipids, the amount of the fat in consideration. And sometimes if we use that in the dosing of diazepam or some antibiotic, okay, that will can lead to overdosing, okay, because that antibiotic or that diazepam will go and be stored in the lipids, and they be stored in the fat tissue, and that can lead to double dosing, okay, of the medication. I'm not sure if that makes sense.
Yeah.
Sure.
Yeah.
Okay, so that's all what I want to say in this case. I'm not sure. Do you have any question?
I have question, but I will ask later on.
Okay, sure, no problem. So I will close the recording and then I will give you your specific feedback. Okay.